to attend the special meeting of the Health and Community Committee, which will be a hybrid meeting conducted remotely via WebEx and physically in the Council Chamber, Derry Road, Strabane, on Thursday, the 19th of February 26 at 4 p.m. So I'll commence just with the roll call. So Alderman Cook.
Online.
Alderman McMorris. Alderman Montgomery.
Online.
Councillor Lillian Barr. Councillor Raymond Barr.
Online, Karen.
Councillor Boggs. Councillor Clark.
And Shaw.
Councillor Devine.
Apologies.
Councillor Duffy.
Apologies.
I think joining a little later, possibly. Yeah. Councillor Hutton.
And Shaw.
Councillor McDade has apologies. Councillor McGowan. Councillor O'Farrell. And Councillor Tierney.
Online, Karen.
Thank you, members.
And apologies from Paul.
And we have apologies, sorry, to note from
Boggs.
Councillor Boggs as well. Thank you.
Thank you, Karen. And I will now read the broadcasting statement. I would like to remind everyone present at this meeting in the chamber or in attendance remotely that this meeting will be broadcast live to the internet and will be capable of repeated viewing. This broadcast may be terminated or suspended in accordance with our protocol. Due to your attendance at this meeting, you are consenting to being filmed and to the use and storage of those images for broadcasting or training purposes and for the purpose of keeping historical records and making those records available to the public. Members and approved speakers are reminded to only have their mics and cameras on while speaking at the meeting and to use the chat facility to highlight a request to speak. A copy of the Council Privacy Notice may be found on the Council website. Declarations of members' interests. Does anybody want to declare an interest at this stage? Okay, thank you very much. So members, this is a special meeting of the Health and Communities Committee, and we have three very informative presentations here today as part of the deputations list that we have. And it's great to see that we can get three on together and try and get through the list as best we can so that we're kept well informed of the services that are out there that would be beneficial for us to know about as a Health and Communities Committee. So the first deputation today, we have Grace and Mairead from Chest, Heart and Stroke. The ladies have a presentation and then we will be able to ask them a few questions. But girls, you're very welcome here to the chamber, and it's great to see your enthusiasm to get here and tell us all about Chest, Heart and Stroke. So the way it works here is we give 10 minutes for the presentation, and then we open the floor to members to ask questions or voice their opinion on any of the stuff that you are going to be chatting about. So James is here and he will provide the slides and you can just ask him to move on to the next slide. So, all right, Gears.
So thank you very much for having us here today. So I'm Maeve and I'll be talking through our care services, and Grace will be talking through our Work Well, Live Well programme. So we're very grateful to be here today. This year we're celebrating 80th years of Chest, Heart and Stroke. Okay, so next slide, please. So why are we here? So in the adult population in Northern Ireland, there are 1 in 5 have a chest, heart and stroke diagnosis. So that's around 290,000. We predict there's at least 110,000 who are living with an undiagnosed condition. And in total, there are approximately 400,000 living with a chest, heart and stroke condition, and it could be much more. And that works out to at least 1 in 4 living with a condition. So we have been leading the fight against chest, heart and stroke illnesses in Northern Ireland since 1946. And I'll go through now the care services and what that's all about and how we can support people and their families living with this condition. So next slide, please. So first of all, in terms of our funding, so almost 90% of our income comes from public donations. So that's whether it's direct or recurring donations and fundraising events. We have some funding received from health and social care trusts, and some funding obtained from one-off grants from various organisations. So next slide, please. So going through our care services then, next slide, please. So who can be referred? So into the care department, anyone over the age of 18 years in Northern Ireland who have a diagnosis of a respiratory condition, a cardiac condition, and a stroke condition. We have support available for anyone caring for a loved one with any of these conditions. And referrals, we receive them from healthcare professionals, self-referrals, and other agencies. Okay, next slide, please. So family support. So this is a service that really is a launch pad for anybody being referred to us. So for anyone that is referred, they receive family support. This involves being contacted within 5 working days and then being offered a home visit within 4 weeks of being in contact with us. This is where our coordinator would be coming out to their home and providing that emotional support and giving the client that opportunity to really talk through their condition, and we can then design a pathway to support them best and to meet their needs. Internal and external services are discussed at this point and offered. Okay. I have a video that will be following next to give a little snapshot of our family support service coming to life. So if you can play that, please.
At Northern Ireland Chest, Heart and Stroke, we care for the whole family affected by a chest, heart or stroke condition through our family support service. We will visit you and your loved ones at home, where we can advise you of the local NICHS programmes available to you, such as our PrEP, physio-led exercise and education programmes for stroke survivors.
James, you want me to come off? Will I mute my screen? Do you think that's what it is?
So the slide before that, James, please. Yeah, thank you very much. Okay, so in the home visit, we provide that information and advice on living with and caring for a chest, heart and stroke condition. Internal and external services, this is referencing the likes of the Stroke Association. We have a joint pathway with the Stroke Association and a fast track referral for benefits advice. We also have signposting to other organisations and then support liaison with healthcare professionals. So I'll give a little bit more insight into the benefits advice that we offer. So next slide, please. Yeah. So the financial support, so Chest, Heart and Stroke has a fast track referral partnership with Advice Space. It was formerly called Citizens Advice Bureau. So they provide a confidential, independent benefits review for clients with chest, heart and stroke, conditions. So in addition to advice, they can also help with form filling and appeals. And they also provide support with Blue Badge applications. And this is telephone support. It's totally confidential between the client and the provider, the advisor in advice space. The only correspondence that we would have then following the referral is if they are unable to get in contact with the client. This has been operating since 2019 and has been very successful, and it's a main pillar in our family support service in our home visit, where a lot of our clients that we encounter, they don't know the unclaimed benefit that they could be entitled to. So that has been really, really helpful and successful in supporting people with change of circumstances. Okay, so next slide, please. So just to give a little bit more insight into our programme, so Taking Control is our self-management programme. This is evidence-based and it's under licence created by the Stanford University. Each session lasts 2.5 hours and topics covered range from managing difficult emotions, managing and improving sleep, goal setting and being solution focused, and this involves setting weekly goals, healthy eating and communication skills. So it's very much a self-empowerment programme. It is encouraging the clients to set goals that they wish to achieve, not what they think that we would see them, that would help them best. And this is across all 3 conditions and for carers as well. So it's not specific on any one condition. Okay, next slide, please. So well-being support, well-being sessions, these are face-to-face peer support sessions to help reduce feelings of isolation. So the programme is based on different themes each month. For example, looking after your mind, physical activity, healthy eating. We tie it in with different themes in the month. So Heart Month, for example, in February. And activities are scheduled with educational, informative, or entertaining component delivered by an external facilitator or chest, heart and stroke staff. An example of an external facilitator would be the home safety officer, just given one example. So next slide, please. So to give insight into the face-to-face wellness sessions that we have running, so for our stroke wellness sessions, they run September to June, the 1st and 3rd, Tuesday or Wednesday of each month, and you can see that we have programmes in Limavady, Omagh, Foyle area and Enniskillen. Our respiratory wellness sessions, again, range in Foyle, Enniskillen and Omagh, and they meet once a month. The stroke support sessions meet 2 sessions per month. And we know that the Cardiomyopathy UK and British Heart Foundation have supports that run in Northern Ireland, so we signpost to there. And we're also aware that there is a patient-led programme and group called Heart Failure Warriors. We know that they're anticipating to set one up in Sion Mills, and it's supporting the development of that with that group too. We also have postal support throughout the year if anyone is unable to join our sessions, but in terms of our home visit and our family support, we can help arrange the likes of transport and setting them all up with community transport. Okay, next slide please. So in terms of stroke support, this is our post-rehabilitation exercise programme, which is PrEP for short. So this is a 6-week face-to-face programme for stroke survivors. It's physio-led exercise circuit. It's evidence-based, so all the exercises have been proven to really support people who've had a stroke. Peer support, which is so important. We hear a lot of feedback from clients to say that it's so lovely to meet people who are in the same boat as them. And then educational component. So topics range from defining what is a stroke, emotions after stroke, healthy eating, managing fatigue, and then signposting onwards. So referral into post-rehab exercise programme, it's within 2 years of clients having their stroke. Next slide, please. In terms of support for cardiac and respiratory conditions, so we have 2 bespoke education programs, both of which are 6 weeks long. And for the cardiac, it's that specific going into what a heart attack is, what a stent, heart failure, and then the similar themes: emotions after diagnosis, adopting healthier habits, talking about how to read food labels, exercising, to be aware of, no prolonged overhead work, for example. And we have the same then for respiratory education, where we then look at positions of ease and breathing techniques. So it's another opportunity for that peer support, which further aids in self-management. Next slide, please. So currently we are recruiting. We'd love to establish a Breathing Better support programme in the Strabane area. We've been in touch with the centre manager, Alex Curry, in Lisnafin Community Centre in Strabane to help establish this. We're very, very keen to establish and set up groups where the need is there. So once we receive, referrals in the Strabane area, that absolutely gives us the rationale to establish a wellness session and an education programme. Currently, I just looked at our statistics and we've only received 16 referrals in the Strabane area. So, our most recent programme that we've established is our respiratory group in the Derry area. And that was based off, that there was a need. And now we have 17 regular attendees that attend monthly in our respiratory programme. So that's just one example. If we receive referrals, we absolutely can establish support, face-to-face support in the Strabane area. So next slide, please. So in order to refer to our services, it's directly from our website. You will see a sign, Care and Support, and from there is our embedded online referral form. This is open to health professionals, members of the public, the people that are living with the conditions themselves. And as I said, that we will be in touch with any referral within 5 working days, and then home visit arranged within 4 weeks. And then next slide, and this is the last slide of the care services overview. So this is just to give a snapshot of our care impact. So between 2004 and 2024 to 2025, with 2,800 people supported during this year, just short of 5,000 support activities provided. We have supported 324 people with cardiac conditions, 515 living with respiratory, 1,765 with stroke, and then care support 203. So I suppose you could say that our most established is stroke. The little teenager, as you could say, in our support profile is respiratory, and then the little baby that we're trying to really grow and flourish is then our cardiac support across the province. So thank you, and I'll hand you now over to Grace, who will go through our Work Well, Live Well programme.
So as Maeve's kind of chatted around the care side, I'm just here kind of to give a bit of an overview of our prevention work that we do. So we are kind of trying to look at lifestyle behaviours that people can potentially change to reduce their risk of a stroke or heart attack, and potentially then needing the help of Maeve's team. There is so much that I could go into. We work across workplaces, communities and schools, but for the purpose of me being here, I wanted to kind of talk about our new programme that we're rolling out in the Western area, and trying to kind of recruit businesses and get them involved in our Work Well, Live Well programme. So I suppose in terms of, next slide. You might ask the question, first of all, why would a business consider investing in their workplace? And I suppose we can see from the research that a third of adults roughly spend their adult life at work. So that's a long time to be at work. And I suppose what we want to try and do is target the workplace to improve health outcomes. It benefits employees because their health improves, they're often happier, but they're often more productive, so that's benefiting the business in terms of increased revenue. It also is a benefit on our NHS in that it reduces the burden that we know is placed on our NHS at the minute. You can even see from that statistic, or that piece of research there by Deloitte, that for every £1 spent on supporting wellbeing in a workforce, employers roughly get around a £5 back in terms of revenue. So it just highlights the importance, I suppose, of how a small amount of investment can lead to great reward. Next slide, please. In terms of what the Work Well, Live Well programme actually is, it's a free workplace health and wellbeing support programme funded by the Public Health Agency and delivered by ourselves. My role as kind of a Work Well, Live Well coordinator would be to support the workplace in terms of improving employee health, wellbeing and culture. I'm not there to dictate, but there is a point of contact. There is a video. If it's not going to work, yeah, do not worry. So the video will kind of give a little bit more information on that. But again, next slide, where I'll talk about our journey. So this is the journey. Again, I'm going to roughly kind of briefly outline it. It's a 3-year program, the Work Well, Live Well program. Basically, businesses will work towards, in the first year, their bronze accreditation. So a workplace will register their interest. We will then reach out to that business. In that, we will then carry out a survey. So we will get that business to send out a survey to their employees. And that will then highlight the greatest needs of the business, or kind of the greatest needs based on what outcomes or what results we get back. The survey is based on the WHO workplace model. And so it looks at personal health resources, it looks at the physical working environment, the psychosocial element, and it also looks at social enterprise. The business or workplace will then recruit ideally 1 to 2 workplace health champions, and they will kind of be the drivers of health initiatives and basically putting the action plan that we help the business to create. They're kind of driving that on the floor. The training incorporates Take 5, which is basically Take 5 Steps to Wellbeing. I'm not sure if any of you have kind of heard that, but it's kind of an initiative through the Public Health Agency about looking after our wellbeing. Again, I'd encourage you, if you don't know about it, have a look in your own time. Again, in terms of, I suppose, then we'll give some mentoring where they will then work towards their bronze. In the second year, it's kind of looking at safe talk, suicide prevention training, and we will give kind of the update of action plans, because we acknowledge that kind of there can be changes in the workplace. And in light of that, we need to update action plans. Next slide, please. And then I guess in the third year, businesses will work towards their gold accreditation. That's kind of largely focused on mental health first aid training, looking at businesses becoming trauma-informed workplaces. And again, we will be updating the action plan to kind of in terms of changes that have happened in that workplace. The final slide, or sorry, the penultimate slide, is kind of looking at just some feedback that we've received from this programme, and it just reinforces the research and the evidence that supports investment in workplace health. It shows this from this feedback in terms of through a school and a business related resourcing. They highlighted how the benefits were in terms of a stronger sense of community among staff, improved relationships, better employee health outcomes, improved morale and productivity. And then final slide. So lastly, I guess I have given a very quick overview in terms of what the Work Well Live Well programme is. And like I said, this is a small snippet of the prevention side of things within chest, heart and stroke. There's so much more that we do, but if you know, or if there are businesses within Strabane that would be very interested in becoming a Work Well Live Well accredited workplace, then please pass this QR code on or visit our website, NICHS Work Well Live Well. Thank you.
Lovely, thank you very much. That was very interesting. So at this stage of the meeting now, we will open the questions for the members to ask. But that was really informative, George. I suppose chest, heart and stroke is maybe a household name. We know that they exist, but just reading through the brochure here, the amount of work that you're doing is actually phenomenal, and particularly spreading it across the community sector, schools, businesses and the workforce, because I think that that's where you're going to get the good access to people when you physically go into your workplace, because sometimes when we run community events, it's hard to get the bums on the seat. But when you actually go in and pitch stuff like this to workplaces, it does resonate with people. But I think as well, when you talk about health inequalities, and we look at the health inequalities impact report, a lot of areas of high deprivation are the ones who are presenting with cardiovascular disease, strokes, because there is a high prevalence of smoking, diabetes, obesity, high blood pressure and all of that. So it's really reassuring to know that these are spread about and that those services are available to everybody. So I'll stop talking now and I will ask the members for their questions or comments. And the first indicated speaker is Councillor O'Farrell.
Thanks very much, Chair, for letting me in. I just want to thank you on behalf of Sinn Féin for coming in and doing this. I have to say it's been enlightening to say the least. And I tell you what, it's an educational journey too. The stuff you went through there is unreal, because we all know people who have suffered from heart attacks and strokes, and people really don't know the difference between a stroke and a heart attack. But the fact that you are going out into the communities and looking people to take yous on now, there's loads of community groups, and I would say they would love to have you there, because some of the community groups give actual free health sessions, and I've availed of them myself. And do you see the figures you were putting up to 1 in 5? As you said, that's not a realistic figure. That's probably 1 in 2. You know, most older people have some form of thing that they don't even know they have. Now, I can't sing the praises of the community groups high enough, because I went to them myself and realized that this, that, and the other. I had no idea that I had this stuff, but the work that you do are unreal. But I did want to ask you, do you go into secondary schools?
Yes, we do go into secondary schools. So a lot of, and again, my workplace, but we have a schools team designated for going into secondary schools. A lot of work that they're doing at the minute is around vaping. We know that that's kind of on the rise, especially amongst teenagers. And I suppose we still don't know enough about the long-term effects that that is having on lung health. We know it's not good, but there's a worry about actually what long-term damage is happening. So yes, we go into schools, secondary and primary.
Could I just ask you as well, how are you paid yourself, your workers? I know you rely on donations, and I see 90% of your money comes in through donations. How are your workers paid?
So we have some service level agreement, certainly in care department, where there's only, a set number of hours where, for example, for our PrEP program, there's a set number of hours that is in the service level agreement with the trust, that is funded by the trust. And then the rest it's those public donations, it's those legacies, it's all of the donations that we get. That is our salary stream.
Garoma Ugat, and listen, keep up the good work. You're doing a fantastic job now. without a doubt. Listen, much appreciated.
Thank you.
Thank you, Anton. And Marie, just on the vaping stuff, I'm part of the task and finish group around tobacco and vaping, and there is a representative from your organisation. And we had a meeting there last year in your Belfast office. And I have a motion coming to full council this month in relation to the attitudes and behaviours of young people around vaping. So that research with the PHA and health intelligence it's stark, but we're glad that we have it. But as you say, the health stuff will come later because we just don't know how much damage it's causing. So the next indicated speaker is Chelsea Alderman Cook online.
Thanks, Chair, for letting me in. And on behalf of the DUP, I would just like to thank the girls from Chest Heart and Stroke for coming and presenting their deputation to us today. It was a privilege to hear more about the life-changing support and vital services that you provide to individuals and families affected by chest, heart and stroke. The compassion and dedication shown by your team are a true testament to the impact that your organisation continues to make within our community. This is particular item holds a special place to my colleague Alderman Julie Middleton. It has great significance for her, and the cause is very close to her heart and loving memory of her father, Cyril. So your work represents hope, support and strength for families like hers and for so many others across our area. So just thank yous again for taking the time to engage with us and for the invaluable work that you carry out each and every day. And we look forward to continuing to support and promote the important role that your charity plays in improving lives. So thanks again.
Thank you.
Thank you, Alderman Cook. And the next indicated speaker is Alderman Montgomery online.
Thank you, Chair. I just want to thank Grace and Mairead for coming on today. It was very informative talk that you had, and it's very stark statistics of people with undiagnosed issues. I just was looking to know how you're ensuring about the rural communities and those without digital access gets the benefit from your services and programmes. Is it like you're going into the community centres? I know Councillor Farrell had mentioned about the community centres, but I was just interested to know how about you're going about it. Thanks.
Yes, so for any client that is based in a rural setting, we would go out into their home. If they feel like socially excluded, we would support them in registering with the likes of rural transport. Our services, particularly out in the community, they're all face-to-face. We did do them all online during the time of COVID, but now we run all our services face-to-face, which has been really, really helpful. There's excellent numbers that are attending bi-weekly and monthly to all of our sessions across Northern Ireland. Actually, we're hitting every corner. And then during that time, say for the likes of if a client does require support with getting online, that would be included in our family support service in supporting them with that. And if we are unable to, it's signposting them to someone in the community that can support them. So no one will be left isolated or alone by any means.
I suppose just to add to what Maeve was saying there, from a workplace point of view and trying to access more rural workplaces, we're not just interested in, the well-known ones potentially in Strabane, but rural businesses as well. So I'm quite passionate about actively making a point of trying to go out and make my face known and try and get businesses on board, because I think it's really important, that we can cover all. So yeah.
Thank you, Alderman Montgomery. And the next indicated speaker here in the chamber is Councillor Clark.
Good, Aisling. And thank you to both of you for coming on. It was really, really informative. I didn't realise that chest, heart and stroke had such a complete wraparound service. You hear of you and you just think, oh, that's great. But I myself have atrial fibrillation, so I know now who to come to should I need a wee bit of help. But no, what I picked out of it was the self-empowerment tool. That's an excellent idea, because
when people are diagnosed initially, they can kind of go on themselves and they kind of get a wee bit down. So I think having that chance to maybe feel that wee bit of empowerment that you can help yourself and you're going to get better if you might have to make adjustments, but says me sitting drinking coffee, like, but anyway, but making adjustments and stuff like that there with a self-empowerment tool is fantastic. So I just want to thank you. It's amazing. But you see, while we have you here, whereabouts in Derry do you base? Are you static or do you kind of go to different places?
So all our coordinators are home based, but in terms of where we run our services, it's Leifer Wellbeing Village.
That's actually my constituency. So there you go.
You're absolutely more than welcome to come and visit.
I might actually take a wee scoot down someday.
Absolutely.
Is there a certain time or a day?
Yeah. So on Thursday mornings, we run our physio-led exercise program.
Mhm.
This is where the physio is, contract by the trust to run that session. We have our every other Wednesday is our stroke wellness program. That's for stroke and their stroke for their caregivers. And then on the third Monday of every month from September to June, we have our respiratory wellness sessions. And that's supporting then anybody living with a respiratory condition. Yeah, delighted to have you. Thank you.
That's great. Thank you, Councillor Clark. And you can see, I was just going to speak to you about maybe us promoting some of those services on our social media. Adele is online, but Alderman Montgomery has also asked that that be done. So we're all in the same sort of vein of thinking, and particularly with Amanda not knowing that you were actually based within that village. And I think when you were doing your presentation, the family support really stood out for me as well, because a family member taking a stroke, a heart attack, or any other condition like that can be very disruptive, and it's about how they navigate through it for that person to have as normal a life as possible. So I do feel that it would be really appropriate for us to advertise some of the services that are offered locally here across the Derry City and Strabane District Council. So we may be in touch again to get finer detail about that, just in relation to Grace, what you've just been talking about there. There's different clubs and different sessions that you do offer. So we'll do that if that's okay with you. But just to say a massive thanks again for coming in, and it has been really insightful for us to get to know chest, heart and stroke a wee bit better. And suppose it'll be a shared learning here today, and we'll be able to go out of the chamber and talk about it among our own family and friends and within our own communities. So thank you very much, ladies, and safe home. Thank you. So members, we will move on to the second deputation of today, and I would like to welcome Sean Deasy in the chamber here today, who is the Strategic Partnerships Manager from Red Zinc Services Limited, Project Help. Sean, you're very, very welcome here in the chamber today. We're delighted to have you to explain about this amazing project. And how it works is we give 10 minutes for a presentation, and then we open the floor to the members, both here in the chamber and online, to ask questions or voice their opinion. Is that okay, Sean? So we're ready to go. James is here at the back of the room, and if you just say next slide, he'll move the presentation along at your pace. All right. Thank you.
Okay. So I'll get started anyway. So we've developed Project Help. You can see the project team there. We have a lot of different partners from DCU, the Western Trust, the Derry GP and Western GP Federation, Eglinton Community, CTRIC, Ulster University, etc. I won't name them all, but we got together and started putting this project together. And the aim really of it is to be able to provide a virtual clinic whereby patients in the community can avoid hospital admissions. Low acuity patients generally, patients who often end up in hospital where they may not need to be there and end up spending more time than they should within the hospital. So next slide, please. So I'll just give a quick summary. I already have touched on it, and then a quick overview. In my haste to do the slides, there is no next step slide, so we don't need to worry about that. So next slide, please. Brilliant. So that's the summary. As I said, it's a jointly developed solution. I named the project partners there. The aim really is to provide a virtual clinic model for patients in the community, looking to avoid hospital admissions where suitable, and allowing patients to be cared for in their own home setting. We're looking for your support, really, which is one of the main reasons we're here, but also perhaps to discuss different ways we might be able to progress this project going forward. Next slide, please. That's a sort of an overview of it. The project is broken into two key parts. Part A, which is community virtual clinic, and Part B, which is a digital healthcare community resilience building. Now, Part A is essentially what we aim to put in 1 or 2 virtual clinics attached to a hospital, so most likely Altnagelvin or perhaps Swad, depending on where the geography of and scope of the project ends up. And that would house a team of nurses and have consultant oversight, and the team could remotely monitor patients from that virtual hub. We also have, as part of Part A, mobile hubs as well, which would be district nurses, generally with the GP practice, who can do home visits to some of these patients where necessary. And the Part B is really a key part to it, and this is all about educating the community and potential patients and people within these communities. One, around this being a viable option for healthcare for them, and 2, for them, their family members, or indeed their carers, to understand, 1, how to utilize technology like this and how we can harness it best for patients to be cared for in their own home and avoid hospital admission where possible. Next slide, please. So that's Part A, that's the community virtual clinics. Now, traditionally, what we've seen with hospitals and GPs is that GPs, if they have a question mark over the patient, will refer directly to the acute hospital in most cases. What the hospitals are dealing with at the moment, and having spent quite a bit of time in Altnagelvin over the last couple of years, is a huge amount of overcrowding, especially in the winter months, and they're running well over their capacity. Often we've found, especially in elderly patients, they're ending up spending a huge amount of time in hospital, and the deconditioning risks that come along with that are quite prevalent also. So what we're proposing here is that we set up a virtual clinic attached to the hospital and with consultant oversight. But the whole aim of such is to provide an admission avoidance for the patient. So a GP can refer directly to this virtual clinic. So the patient does not need to attend the hospital. They'll be set up with some sensors that I'll show you now in a moment. And that will allow a clinical team in these hubs to remotely monitor the patient, engage with the patient on a day-to-day basis via video and questionnaires and messaging functions, and then have mobile nurses to administer drugs or carry out care where necessary. And the whole, I suppose there's two key benefactors from this really. The patients and people within these communities who do not want to be in the hospital, and of course the hospitals themselves. Can we reduce the pressures on the acute hospitals and that the acute hospitals are facing, specifically the emergency departments of these hospitals? And can we help reduce their overcapacity issues being faced by them on a day-to-day basis? Next slide, please. That is the Blue Eye ecosystem, and that so I work for a company called RedZinc. We're specialists in telehealth. Our suite of solutions is called Blue Eye, and that's really an overview of the ecosystem. We've designed it with patients at the center. Patients get what we call a green box. It contains a set of biometric vital sign sensors and a smartphone, which allows the patient to be remotely monitored. The clinical team can then see the patient data coming through in real time. They can review the patient's data from the past number of days. They can engage with the patient via video or indeed by questionnaires on a day-to-day basis. And they can be alerted to any changes in a patient vital signs by a warning set up within the solution. Any member of the MDT or indeed community nursing team can have access to that patient information and can engage with that patient if they're part of the broader team. Next slide, please. That's just a little bit of the overview in a little more detail in terms of the green box. It comes with a smartphone that is a 4G or 5G SIM card. The sensors connect to the smartphone via Bluetooth, and then the smartphone sends the data over to the clinician-facing dashboard via 4G or 5G, or indeed a patient's Wi-Fi if they do happen to be in a black spot. Now, I know this will not be for everyone. Some elderly patients won't have access to any of that internet. Some elderly patients won't have the technical literacy or the support from family or carers to be able to do so. But it will, we expect that to improve, and through our Part B, our community resilience, we hope to be able to increase the numbers who would be suitable for a project like this. Next slide, please. At the end of the day, it's all about the patients. We're a team predominantly of engineers and people with business, but really the inspiration behind all this became having had parents and sisters or brothers or whomever it might be who've been in hospital, who've ended up spending a week there where really after maybe a day or two, they didn't need to be there. Understandably, consultants are slow to discharge patients if there's any question marks. We understand that completely. But being able to provide an alternative whereby the patient is being monitored, they can see how they're doing, they can engage with the patient, but that patient doesn't need to be in the hospital. And we can reduce contagion risk, we can reduce deconditioning risk, and it's just a better all-around environment. We all want to be at home whenever possible if we're unwell. And if the patient has the necessary support to do so, we're aiming to provide that outlet for them. Next slide, please. That's Part B, and this is what we've been working with Debbie Caulfield and Eglinton Community Group with. Not limited to Eglinton. I know Debbie's done a bit of work with the council on a couple of different projects. And Joan Condell of Ulster University introduced her, said she was great to work with, and she has been. And And from that, we've developed this, this community resilience building. Ideally, what it is an outlet in the community centres for patients, for local carers, for family members, whomever it may be, to come in. We can educate them on how this would work. We can educate them, first of all, that it exists, and then we can help them with the technical side of things and any other questions or thoughts that the community may have. And the aim will be to do that alongside in the north with Ulster University, and of course the community groups that we in the communities we aim to serve. Next slide, please. That's just a broad overview. The birth of this project was a cross-border project that we submitted to Peace Plus 2.4 call last year. Unfortunately, we did not receive funding for that as we contravened their funding rules, as we are a private company and we were listed as a project partner, not the lead partner. But we aim to go back in for a future call, or indeed to discuss a few other calls that may be available to get this project started. But essentially what it is, that's a bit of the geography of the initial project. I suppose what I'm presenting today will probably focus on the north of Ireland side of things. We would aim to have 1 or 2 virtual hubs, as I said, attached to Altnagelvin and SWA, or indeed OMA. That would have to be decided within the planning phase. Then we have community mobile hubs attached to the GP practices who will be involved, whereby we'd have a district nurseman who could visit the patient in the patient's home where necessary. And then, as I said, the self-care resilience hubs in the community centres, within the communities we aim to serve. Now, as I said, in the project we submitted, it was both sides of the border, and we had a number of small rural towns that we had decided to focus on to start with. Given that that project is now no longer directly being reviewed by Peace Plus, the exact makeup of the communities that we aim to provide for to begin with has not been decided, and it can be up for discussion later on today and going forward. Next slide, please. They're the output indicator. I suppose the whole point at the moment, it's slightly more than a proof of concept, in that we know the concept works. We've worked with the hospital at home team in the Western Trust and done a pilot with them. I suppose this is innovative in the way that it's focusing on lower acuity patients and trying to avoid hospital admissions altogether, as opposed to providing an early supported discharge model. We believe following the initial project, we would hope that the solution will be taken up by the Western Trust and scaled to as many communities as we can serve, and then ultimately to become a nationwide service once we've developed it. As part of this, of course, Ulster University will be, and if we're doing in the south, Dublin College University, Dublin City University, we'll be doing continuous evaluation and dissemination of those results, including with Harani as well, who are partners on this project also. Next slide, please. That's just the delivery model. I'll skip across that because I'm wary of time. So next slide, please. Come back to that in the Q&A. In terms of the costing, of course, it has to make financial sense for this to be scaled in any way following the initial phase of the project. On the left-hand side there, you can see the costs, NHS costs for a patient per bed per night. All in, it's coming out over £1,000 per night, for including diagnosis and treatment of the patient. For simply the bed and breakfast and perhaps the day-to-day OBS checks, it's coming in less than £400. Now, they're huge numbers for a patient, huge costs for the Western Trust, or indeed any of the trusts who are looking after the patients. Our solution, including the nursing and doctor oversight, comes in at about 150, excuse me now, I had to do some maths today, £167. I have it in euro there. Is the current rate it would come in at. So less than half of the cost of a patient merely being in an NHS or indeed a Western Trust bed for a night. So the cost savings are clear for the hospital, and can provide further evidence for why we could hopefully get as many patients to avoid these admissions where possible. Next slide, please. And that's it. This was going to be my next step slide, so I'll make it very, very brief. Thank you all for your time. I suppose the reason we wanted to present to you all is we'd like to get further support. We feel like we have a really, really strong project team with expertise from all different areas in the healthcare space and indeed the education space. And I'd be more than happy to answer any questions you have. If we don't get around to it today, you're more than welcome to get in touch with me afterwards, and I'd be more than happy to take you through the project in a little more detail. So thank you very much for your time, and I'll pass back over to you.
Brilliant. Sean, thank you so much for that really comprehensive report. And it's good to hear it from the person who is involved in the design and the delivery, rather than just reading stuff on paper and being here to be able to ask those questions. I think it sounds absolutely fantastic. And I think what's really key to this working is partnership working, being sort of involved collectively with every single community organisation, the trust, which you're going to meet tomorrow. I think that whole cohesive working is what's going to make this work. But can I ask one question? We obviously it's going to be cost saving as well. If you says here, it'll reduce the cost by half. One of the issues that we currently have within our local hospital here at Altnagalvin is delayed discharging because of the care packages that aren't available then within the community. Can you foresee this being an aid to that problem that we're currently having at the minute?
In the initial phase, possibly not. I think the focus will have to be on avoiding the admissions. Having worked with the hospital at home team last year for a few months on pilot service, I think one of the issues they've faced is that they're having to focus their time on high acuity patients and often palliative patients. And that's probably not helping the bottleneck in hospital that you're referring to. So we've designed the initial phase there, as you can see, but as you said, the co-creative part of this, and as it scales, perhaps that would be a more logical scaling as opposed to, okay, it's worked here, let's set up in 10 different hospitals. Perhaps we could extend it to providing those early discharges. I suppose the initial issue maybe is the cost that it would cost to get those care packages in place, and I'm sure that's probably a contributing factor to why it's not already there for some patients in the Altnagalvin catchment area. But it's certainly something, and I suppose it's one of the reasons we wanted to speak today and speak to you all, is that if that's one of the biggest pain points for the people in this area, the patients, and of course the hospital and the trust, then that's definitely worth exploring a little further in the makeup of this project and the different phases we can look at.
Well, thank you very much, Sean. I'm going to open the floor now to the first indicated speakers online, and that is Alderman Montgomery.
Thank you, Chair, and I just want to thank Sean for coming in. Sean, when I first met you in Donal, I was very excited to hear about this project, and I still am, and I was very keen to get you in, so I'm glad that you've come in and everybody can hear it for themselves. I know we talked a lot about helping the community, and I do believe this project could help with waiting times in the hospital. As we know, a lot of people now are putting off going to the hospital when they get that first sign of something's not right. And because of waiting times in A&E, and it could cut down a list of people actually getting admitted. Just wanted to ask you around the data security. What steps has been taken to ensure like patient privacy and compliance within the UK health standards are met? Thanks.
Yes, so I suppose number one, the initial stage to this would be a full GDPR agreement with the hospital. As a company, we're fully CE marked, and we've gone through all the regulations and held all the certifications in that regard. I mean, their data is the most important thing, and we put I suppose, it's top of our priority list that everything remains safe. Now, given the new electronic record within the Western Trust, and that may have be part of I suppose, the planning phase of this project. We wouldn't actually hold the data. Obviously the data would be visible, but as soon as the patient was discharged, the likely result with this would be we would send all the data back to their EHR in the Encompass system. But as I said, we have a very tight GDPR process, and we would have to come to an agreement and sign all the necessary agreements and processes with the Western Trust. And any of the patients that are going to be in would also have to have to sign a consent form as well to understand that the data is visible by the clinicians, but nobody else. And it is a very, very secure solution. We have two-factor authentication. Every consultant or clinician who's using it will have to use their own account, can't share an account, and there's strict protocols on how they need to engage with the data once they're using it. So yeah, the data security is really our number one priority in terms of keeping everyone's data safe, especially the patients who are their vital signs are coming through.
Thank you. The next indicated speaker is Councillor Clark.
Yep, thank you, Aisling, and thank you, Sean, for coming on. That was really informative. And coming from a health and care back, I worked in the Western Trust for over 20 years before coming out into the community. So I see anything like this that can transform services. You know, it's a no-one situation. As I always bring up and here, we have an aging population and a really high prevalence of chronic disease, and things like this will hopefully enable that to turn around. Now, I welcome it, but my concerns firstly is I'm assuming that you are going to be working within the NICE guidelines, given that you are working alongside CTRIC and the GP Federation and the hospitals and everything like that. And then the other thing is the cost overall. You know, where's the money coming from? I mean, money's very tight everywhere, especially in health. So we need to know, who's funding this, where it's going to come, how much it's going to cost overall, because it's very tech savvy, like, and that doesn't come at a cost price, like. As far as the staffing is concerned, I know you've said it's going to be it's going to be consultant led, and there's 8 nurses attached to this. Are they in position at the minute in these hospitals, or is this going to be a recruitment drive, because then you have to factor in new salaries as well? And you're talking band 6 nurses, you're talking starting maybe 38,000, 39,000 pound a year, and that's 8 salaries, and then whatever consultants are going to cost on top of everything else. So I just want to know if they're already in situ. And then thirdly, it's all very digitalized, and that's great, but I wouldn't like, the older generation to be disadvantaged at that. I mean, like, I bought my mother a new phone for Christmas, and I ended up the other day and she was sitting reading Mandarin on it, and I don't know how she changed the settings. So you have to think along those lines. You can't disadvantage a group just because it's too tech savvy. So I would be concerned about that it's rolled out, that there's nobody disadvantaged, and will there be a helpline or anything like that if somebody else stuck? But it's brilliant, and it looks great, and I really do hope it takes off, because I think it could revolutionise healthcare. But it's just getting all the bits and pieces. And the other thing too, and Janice already mentioned this, was Encompass has just taken off. So we'd just like to think that it would align with that as well, given that's two different systems as well. So thank you.
Yeah, thank you. I suppose I'll start in terms of the funding. Originally, this is a Peace Plus concept that we submitted to Peace Plus, and I have the breakdown of the budget. I don't have it off the top of my head, but I'm happy to share that with you after this, no problem. I suppose it's a mix. It's unrealistic for us to say that they're all in situ. Number one, the Western Trusts have to be comfortable for, if they are in situ for these nurses, to probably split their time between the hub that we're suggesting and probably their in ward work. In terms of the consultant, so what we've seen in the South quite a bit over the last few years is the drive for integrated care consultants. So they work half within the hospital and half their time in a community setting, generally in community health centres or integrated care centres or whatever you like. We've worked alongside a consultant, Nazi Chowdhury. She's a respiratory consultant in developing a couple of different projects, but including this one. But if I'm not, that would have to be decided in the planning phase. We would hope that we can staff it using some of the staff that maybe are in situ, but we did provide a budget for recruitment drive, and we understand the difficulty in terms of hiring, especially nurses in this current moment. But I suppose the key, especially for the remote aspect of this, is that this could be particularly interesting. What we've looked at really and discussed with a number of people is nurses who've left on the ward work due to maybe injury. Perhaps they're a little older. Perhaps they've left for maternity leave and just don't have the time to go back full time. This would provide them for an opportunity where they can engage with the patient virtually, predominantly. And from what we found thus far, it is quite an attractive option for a lot of nurses who aren't currently working full time and don't really wish to return to on the ward nursing at this point. As I said, in terms of the budget, I can share that with you afterwards. We would be looking. We expect later in the year there'll be 1 or 2 calls coming from Peace Plus that would align with what we're looking to do. I actually spoke with Julie Curtin in SUPB the other day, and she confirmed as much. So that's what we're looking at. I suppose we're based in Dublin, and whilst most of the project team are based in North, we wouldn't know the ins and outs of what's available or what's not available or the funding there. But currently, we'd probably be looking at Peace Plus. We think it aligns most strongly with their funding requirements. And if we alter the project partnership a little bit to comply with their eligibility rules, we think based on the reaction and the feedback we've gotten from SUPB, that they would love to fund a project of this nature. Forgive me, what was the next question?
I was talking about nice guidelines. I take it these are going to up. Yes.
Yeah.
I just see the partnership there, so they all have to operate within them. So I'm just taking that overall the whole thing will fall on behind this.
Yeah, absolutely, absolutely, and I think that's a key part to it. And we'd certainly, before we submit anything going forward, we will double check with all the partners. Again, depending on the scope of the project that we go for the next time around, that might be a little bit different. But we'll ensure it does, yeah, for sure. And the last question was there. I think there was another one around the elderly people, sorry, and their access to the technology. Absolutely, and that's why Part B is a really key part of this project in terms of the community. And as you said, even the projects we've done before, there's patients. I mean, the scale is different. As you said, some patients don't have a smartphone. they don't know how to operate one. Some are like myself, spend far too much time on it. But you know, that's why we want to provide that outlet in the communities to be able to educate. The patient can be passive in terms of the smartphone. They don't really need to engage with it. They just need to be able to have it charged. So whether that leave it in the corner of their room or down in the sitting room, leave it. We provide a dock where they can just pop the phone in and forget about it, and it can be charged there while it's giving off the vital signs. Or indeed, you can have a patient who's very tech savvy and they can engage with the phone, they can do questionnaires, they can do the video calls. We've tried to make it so it'll be usable for all levels of tech literacy. It might not be, it might be slightly beyond them, could be because of where they live and it's a complete black spot. But we've tried to make it as inclusive as possible and to reach as many patients as possible. So that's been key to the design, both of the project, but I suppose almost more importantly, the tech solution and anything that the patient or indeed the clinicians saying to them that they'll engage with. It's as easy to use as possible for them.
Thanks very much, Sean. And the next indicated speaker is Councillor O'Farrell.
Thank you very much, Sean, for that. I have to say now, I think it's a brilliant project, I have to say, and it could work really well and work wonders in rural areas. But again, and it'll take the pressure of our hospitals. Our hospitals are under terrible pressure at the minute. And there's a lot of people, as you already said, going to hospital, they don't need to be there at all. We have a lot of people too, like my mother, who her worst fear is going to the hospital. Now she's the district nurses are coming out and seeing her, but she doesn't want to go to hospital because she'll probably get pick up something at hospital. But this project of yours would take the pressure of hospitals if it ever, hopefully, this will get taken off. But I was going to ask you, what sort of support are you looking for us? You come here today to get us our support. Could you explain and what way do you want that support?
Sure, yeah. Thank you for that. I suppose we're based in Dublin, number one, and we're a small company. And of course, the project partners, a lot of them, this is one of a number of projects, obviously, the trust has more important things to focus on. They love the project, of course, but they don't have the resources to I suppose, create awareness. So I suppose from you guys, we'd love to help generate some awareness around the project, or that this is a viable alternative to the way it's currently being done now, or that indeed we could help. But it, as you said, it comes at a cost, and will come at a cost, and perhaps your support might not be involve you doing much at this point in time. But say we do get the funding and we do the first 6 months, a year, the project, whatever it might be, is a success, and then we come to take up and scale up and those types of things, having the support of the health committee and you all here, I think would lend great weight to the impact it could make, and we think will make. And as you rightly pointed out, being able to, the initial project is aimed entirely at rural communities. I've sort of opened it up to all communities in this presentation, but generally that's probably where we'll make the biggest impact. And as you said, a lot of us will have parents or family members who just don't want to go to hospital, but sometimes that's the only alternative. This won't be the answer for all of them. It certainly won't be, especially in acute exacerbations of whatever their conditions may be. But we certainly believe it'll make a huge difference to a lot of people. And having your support, having your, I suppose, being able to engage with you on an ongoing basis if anything else does come up, or if there's anything else that you think we could have a look at in terms of getting it not just funded, but in terms of bringing on as part of the project, or other things that we should indeed consider when planning the project and finalize the project before we do submit it again. All that type of thing. And I suppose it's great to meet you. You're all experts in this field, I'm sure, and you all play a very important role in healthcare in Derry. So meeting with you and being able to show you this project, but also and knowing that if you do have any thoughts, ideas going forward, or you think we should be looking at, indeed, you're more than welcome to reach out to us. And I'm up and down to Derry quite a bit, so I'm more than happy to call in, say hello whenever. So yeah, I hope that answers your question.
Just so you know, I support I think your project's absolutely brilliant. Just so you know that I just asked that question. Okay.
That's great, thank you. Is anybody else online wanting to come in on this deputation? No? Well, can I just ask another question, Sean? So in relation to project readiness, when do you hope for a pilot to start? For instance, if you get funding tomorrow, are you ready to go?
Absolutely. We'd need to mobilize the team again. It's been about 6 months since we submitted the last one, but certainly if we were to put a submission in, we wouldn't submit anything that we weren't ready to start the day after. And as I said, we've been very, very fortunate through one contact and another to develop more and go from the trust to the GP federations to Harani to CTRIC to we've done the rounds over the last couple of years, and everyone's, I suppose, initial reaction to the idea is very, very similar in that they can see the impact straight away. And I think we'd be able to mobilize very quickly, but we wouldn't be submitting anything without everyone being ready to go on day one. And that starts with the co-creation piece to it and finalizing those operating procedures and thoughts and how exactly the Part B in the community is going to work, and working with the community and indeed patients and patient groups to make sure that once the funding comes, we're ready to go and we're ready to deliver it in the most impactful way possible.
That's great, Sean. Thank you. And within council, we have a civic forum who meet once a month. We had a meeting with the whole teams last week, and that addresses homelessness. It addresses substance misuse, mental health and wellbeing as a whole. And we had a team in called the Summit Team. I don't know if you've heard of them, but what they have done is design an app. They've designed an app for people who are suffering with mental health and substance misuse, that dual diagnosis element of it. And they have designed this app so that people who are in recovery can access services themselves. And it was an excellent presentation, and they did get the money from Peace Plus. So it's a cross-border project, exactly like yourselves, and it's about the sharing of data across the north of Ireland and the south of Ireland. So I can give you the details. It might be worth having a chat with them. They're working with a university, the Queen's University. You're working with Dublin City. I just think that both of you chatting to each other might enhance what you're both trying to do. So it's called Summit, and it's dealing with mental health and substance misuse, the dual diagnosis approach. So the app will give people that control back to access a service when they need it, and obviously have that service on hand as well. There's a lot of training that's going to be going on behind it. But I do love the idea of both, because it's given the patient control and it's given the family control as well, where they can co-design what pathway they want to take at that stage of their life. So Sean, that's everybody. There's nobody else online that was wanting to come in. Just to say a massive thank you for coming along. You have our support. We are so invested in this and wanting to know more about it as it progresses. So please do keep in touch. Keep in touch with us in relation to the funding, because what we can do from council side is help you to promote this if it does ever come off the ground, or if you need it working groups within communities and stuff like that. cohorts of people that you maybe wanted to trial something on. I suppose we could help in that way as well. So just keep in touch with us and let us know how it's going. So thanks again and safe home. Thank you, Sean.
No, thank you all. Thank you all for having me, and absolute pleasure to speak here today. And as I said, if you do have any more questions or thoughts after today, I think Lorraine, you have my details, so you're more than welcome to share with them all. Please do get in touch. And as I said, I'm up and down quite a bit, so happy to meet with you, or we can meet over virtually as well. So thank you all.
Thank you.
All the best.
Thank you, Sean. Members, we will go on to our third and final deputation for today. And in the chamber, we have Maria Hearn and Lisa Fawcett from the Northwest Breastfeeding and Perinatal Support, which is otherwise known as Northwest BAPS. Ladies, you are very, very welcome here in the chamber today, and we're really looking forward to your presentation. So we have James at the back of the room who has the presentation on his screen, and you can just say next slide and James will flick it on for you. And Lorraine has explained the button here. If you're going to speak, you can press the button on your mic and then switch it off when you're finished. So thank you very much, and the floor is yours. Sorry, I need to say it's a 10-minute presentation, and then we open the floor to questions and opinions from the members, both online and in the chamber.
Okay,
Thank you.
great. We'll try and keep it tight. We may go on a wee bit longer. You can give me a signal if we do. So first of all, just very happy to be presenting today on behalf of Northwest BAPS, and want to say at the outset that we are non-judgmental about how a family chooses to feed their baby, whether they breastfeed or use formula or a mixture of both. And I will explain during this presentation why our focus is specifically on more support for families who want to breastfeed. So slide 2, thank you. It was fantastic to hear the news during the autumn last year that this council area had been awarded the UNICEF Child Friendly City and Community status, the first council in the north to be awarded this accolade. It is notable that this child-friendly status, which is based on the UN Convention on the Rights of the Child, includes Article 24, which is about a child's right to optimal health. WHO recommends that babies should be exclusively breastfed until they're 6 months old, and after that, it is recommended that they continue to be breastfed alongside the introduction of nutritionally appropriate foods until they are 2 or older. Why is that? Why does the WHO recommend exclusive breastfeeding for 6 months? Basically, it's because breast milk is a living food, full of nutrients, antibodies, and even stem cells. It has been described as a medicine and liquid gold. Science shows that when a baby is sick, the mum's breast milk actually changes to produce specific antibodies. Breastfeeding is also more than food and medicine. It supports connection, regulation, and security. There's more and more research with breastfeeding on babies, and this is where there's exclusive breastfeeding for up to 6 months. It reduces sudden infant death syndrome by 60%. It reduces the risk of pneumonia by 63%. It reduces the risk of gastric infections by 57%. It boosts immunity by 50%, and it lowers allergies and reduces the risk of obesity. For mothers, it helps with straight away the elimination of the placenta, which reduces the need for manual extraction, which is quite high in Northern Ireland. It speeds faster physical recovery after birth, and it also releases the happy hormones, which reduces stress levels. It also reduces ovarian cancer risk by 20 to 30% and reduces risk to type 2 diabetes by 30%. In terms of the wider implications of breastfeeding, you're probably all aware that it is the most economically and environmentally friendly way to feed a baby and young child. Breastfeeding produces zero waste, zero greenhouse gases, and has almost zero waste footprint. It has been described as the optimal zero waste food for babies. And just to read out that little quote there from James Grant, who was in charge of the UNICEF for 15 years, breastfeeding is a natural safety net against the worst effects of poverty. Exclusive breastfeeding goes a long way towards cancelling out the health difference between being born into poverty and being born into affluence. And there's a huge amount of research to support that statement. Next slide, please. In terms of the global context, and in this slide, the European context, any breastfeeding at 3 months, and I know that Councillor Duffy actually had taken you through this particular set of statistics. You can see here that it's highest in Hungary and lowest here in the Western Trust. Globally, the percentage of infants under 6 months of age who are exclusively breastfed has actually reached 64%, which is very close to achieving the World Health Assembly target of 50%. And in fact, the Global Breastfeeding Collective has set a new target for babies to be exclusively breastfed, for 70% of a country's babies to be breastfed by 2030. According to the most recent health intelligence briefing by the Public Health Agency, the exclusive breastfeeding rate at 6 months is only 17% in Northern Ireland. It's 14% in the Western Trust and actually 13% in this council area, which is the lowest in Northern Ireland. This contrasts with countries like Burundi, who at 6 months, the exclusive breastfeeding rate is 89%, Sri Lanka 81%, and Peru 70%. Next slide, please. In relation to the local context, in 2020, Northern Ireland didn't even meet the target of 50% of babies being exclusively breastfed at discharge, never mind at 6 months. More recent figures show that the rate in Northern Ireland has actually fallen further, with only 35% of babies being exclusively breastfed at discharge from hospital. And interestingly, the rate has actually increased slightly in this council area, with 30% of babies being exclusively breastfed at discharge from hospital. Research has highlighted that 8 out of 10 mums who start breastfeeding stop before they intended to. And it is for this reason that we would like to see more accessible and quality support for families who want to breastfeed. Next slide, please. So during COVID lockdowns, I was doing some desk research for Belfast Healthy Cities when I saw the breastfeeding statistics for Northern Ireland in general and this council area in particular. I was so taken aback, as these figures had not changed much over 30 years since I had my own children. So I decided to set up a social good company called I Breastfeed CIC to explore more creative ways of turning these figures around. In the spring of 2022, Caroline McGuinness Brooks and myself developed a zero waste parenting program, which included a workshop on breastfeeding. The participants at this workshop were so shocked to learn that this council area had amongst the lowest breastfeeding rates in the world that they encouraged me to contact the council. At that time, Councillor Sandra Duffy was mayor, and she was incredibly receptive to the idea of a community-led initiative. So besides parents who were interested, I reached out to some local advocates and service providers, and Mayor Duffy hosted a breakfast meeting in the Guildhall. I had also reached out to Breastival Belfast and supported them to host an event in St Colum's Park House to celebrate World Breastfeeding Week 2022. In the autumn of that year, I facilitated a public meeting with the encouragement of Councillor Duffy about breastfeeding, inviting parents, advocates and service providers. I have to say it was one of the most stressful meetings that I have ever facilitated, with a lot of anger being expressed by parents and a lot of defensiveness by service providers. However, we did manage to agree at the end of the meeting to set up a group and to begin work on the issues and priorities that were discussed at the meeting. Next slide, please. So Northwest BAPS is I Breastfeed CIC's first project, and it's very fitting that it focuses on this council area. I want to introduce you to the core team of volunteers who formed Northwest BAPS after that initial meeting, and some who have joined us since. And Northwest BAPS, of course, is an acronym for Breastfeeding and Perinatal Support, and no one ever forgets our name, so it was a great choice. This picture was taken at our World Breastfeeding Week event in Foyle Arena, which was launched by Alderman Neary McMorris and attended by Councillor Duffy. Myself, Noella Gormley, Aisling Ryan, Sarah Concannon, Lisa Fawcett, Jessica Clark, Joni Callahan and Sinead McGowan, an amazing group of women who have managed to work together on a range of projects over the past 3 years while juggling families, including new babies, jobs and life in general. Noella recently moved on following her graduation to being a Lalash League leader, another first for this council area, and we look forward to a number of new volunteers joining us over the next couple of months. Next slide, please. In the early days, we were able to avail of the Zero Waste Northwest Hub on Spencer Road, which provided a great child-friendly space for us to meet every Friday morning to discuss ideas which had been raised at that infamous public meeting and to hatch plans to raise awareness, visibility and support for breastfeeding. Early in 2023, we decided to gather people together for Breastfeeding in Public Day at the Guildhall, and we were amazed at the turnout. Around this time, the first Northwest BAPS walk-in group was established by Noella, and we're grateful to the City Hotel for consistently providing a cosy after-walk space and complimentary cuppas. There's now also a Northwest BAPS walk-in group established in Strabane, which meet on Thursdays and is led by Lisa. When the Zero Waste Northwest hub closed down, we were fortunate to be offered a space in the Central Library for our regular Friday morning meetings. Next slide, please. One of the priority issues raised by parents was that information about where to access breastfeeding support, particularly in-person support, was sporadic and often out of date. So we set up an updated weekly menu of support on Facebook and Instagram, and which now has over 1,000 followers on both of these platforms. A really interesting aspect of this weekly information is that a number of agencies who provided breastfeeding support spotted the opportunity to move their groups around, and with the result that there's now at least one support group on every day of the week that any woman can attend. Next slide, please. Another idea put forward at that public meeting was to establish a network. With the support of the council, myself and then Mayor Councillor Duffy co-chaired the first network meeting in April 2023. There were 25 participants representing parents, advocates and practitioners from the community, voluntary and statutory sector at that meeting. We've had a total of 5 network meetings since, and there's been some very frank discussions as well as collaborations arising from these gatherings, including agreement that women in the council area can now attend any breastfeeding support group, even if they're not from that catchment area. We're currently exploring the potential for this network to get involved in an international research project, and there's also ongoing discussions between 4 groups about setting up a bilingual breastfeeding cafe in Derry. We've had great feedback via this group, a sense that local breastfeeding rates are improving and that service providers are getting to know each other and the services that they offer. Next slide, please. I just want to share a couple of pictures of the wide range of events that Northwest BAPS have organised, from the Breastfeeding in Public Days in the Guildhall, including with poet Grania Evans in 2024 and a film screening in collaboration with the Northern Ireland Science Festival in 2025. We've also hosted a number of latch-ons in the Guildhall, the Central Library and St Colum's Park House, as well as the World Breastfeeding Week events, which we've hosted in August each year for the past 3 years, attended by over 200 participants and an average of about 22 stands. Next slide, please. Northwest BAPS have also undertaken a number of projects with the support of local agencies and small pots of funding, including the design of the banner on the back of the Free Dairy Corner to publicise World Breastfeeding Week, a massive piece of work undertaken by Sinead O'Kane to coordinate the beautiful breastfeeding mural, another first in the north, on Great James's Street in Derry with artist collective Peeble, and a recent successful project to design and develop breastfeeding support kits and a website. Next slide, please. Northwest BAPS was delighted to be nominated for 2 awards last year, and we won Best Breastfeeding Initiative 2025 on the island of Ireland from Friends of Breastfeeding. We also got an article published and we feature on the front cover of the Association of Breastfeeding Mothers magazine. Final slide. This is our asks, and literally in black and white. And first of all, before I move on to the asks, I just want to give you another quote, which is from Keith Hansen of the World Bank, who said, "In sheer, raw, bottom line economic terms, breastfeeding may be the single best investment that a country can make." What we're asking for is for the council, we would really love the council to lead on this opportunity of getting involved in the International Breastfeeding Friendly Cities project, an opportunity to be one of 3 cities worldwide to be involved in this endeavour and allocate resources to Northwest BAPS to make this happen. Our second ask is asking the council to continue to support Northwest BAPS project, including co-chairing the network. And our third ask is to support us to become sustainable. This is what we've been able to do with a lot of goodwill, volunteers, and a shoestring budget. Imagine what we could do if we had proper funding. Any help from the council, from statutory bodies, funders or philanthropists who share our vision for a more breastfeeding friendly city and district, more support for families who want to breastfeed, and better outcomes for mothers, babies and the wider community and the environment. Thank you.
Thank you very much, Maria. That was a really good report, and it's given people that maybe don't know that much about Northwest BAPS a good insight as to how it started, what has happened along the way, and where you are actually at now. And I think that it's absolutely amazing that you have come this far. And when Sandra brought the news of the award to the committee meeting, she was very, very excited about it. And I think that she should be so proud of herself as well, because she got involved, she rolled up her sleeves and she helped you along the way. So in relation to those requests, I will be asking that a paper is brought back to the committee in relation to those asks about how we can as a council support them. So that'll be something that Karen will take back as the director of the Health and Communities Committee, but a paper will be brought back and that will be considered by the members here within the committee, or even at full council at some stage, Maria. So thank you for bringing that along. And I do have to say, even though the first public meeting was very daunting, I think it's the best thing you ever did. Most of the stuff that you do is looking after women's and families' emotional well-being, but there's also the physical side of it. You've started the walking groups, and that's really important as well. And then with the banner and the mural, I had written them down at the very start. I think they're absolutely gorgeous, and they're local. They've been designed by local women, and I just think that this organisation is going to go far, and it would be an honour for this council to become involved in it and try and get those rates risen a wee bit. So I'm going to be quiet now and let other people get a chance to chat. And we have members online, and we also have members here in the chamber. So, Councillor Clark.
Thank you, ladies, for coming in. I'm away past the breastfeeding stage now. I mean, like, my children are 20 somethings, like, you know, but I think it's great that we have a group like yourselves, because back then in 1990s, 2000s, whenever I had my children, there was no guidance. You had midwives, you know, and they were just, it was like kind of forced upon you. And if you didn't want to do it, well, it was, you left to your own devices, you know. So I never really, I didn't breastfeed. They were all formula fed. So, but I think it's great now, because my daughter has a wee boy now, he's 4, and she did it for a wee while, and then it just wasn't working. So, and it broke her heart that she couldn't do it, you know, but I just wish I had knew at the time. I suppose you weren't around whenever Arthur was born, but it's great to know now going forward if she's any more, because she really did want to do it, and it just didn't work out for her. So it's great, and I really do wish she's all the best. And as Aisling said, we are more than willing to help you and get the name out there, and get your good work out there as well. It's natural, and I can only imagine it's cheaper as well when you think of the price of a box of formula. I nearly died one day. I had to go to Tesco's, and it was 14 or 15 pound for a box, you know. So in times of economic hardship, you know, it should be something that you would imagine would spur young women on to breastfeed. But I suppose it's a work in progress. I don't know if it's just, you know, an Irish thing where you were affronted to do it in front of anybody, you know. And I think that's part of the whole issue, and it's just breaking down that kind of that barrier as well. No, thank you.
Thank you, Councillor Clark. And yeah, I think there seems to be many reasons here about why we have the lowest rates in the world, and including that we've lost a couple of generations, 2 or 3 generations of people that didn't breastfeed. So it's sort of like a learning and the opportunity for the community to reclaim that. There is a lot of good work going on through all the hospitals in the north that have now got UNICEF baby friendly initiative status, and some of the community organisations are working towards that. But I think the big test really is in terms of the time as well. The maternity services are under such pressure, and we are getting a lot of feedback, both positive and negative, about people's birthing experiences, and feeling the midwives are often so rushed about giving birth. It's almost like luxury if they have time to help you with the breastfeeding. So it's something, you know, that we'd be quite aware of, but we also know that through our own links with the health services, and they're involved in the network, that we are working in collaboration to try and address some of those issues as well.
Another thing too that I noticed recently is, and this sounds quite stupid, but it's proper bras. You know, they assist with your breastfeeding, but I have noticed, you know, in some of the shops that they have a good selection now of, you know, bras that are made for breastfeeding, and they didn't have any of that in my day either. You know, there've been a whole handling trying to get sorted, but I think that needs to be looked at as well. You do notice it in some of the shops like Marks and Spencer's and places do have a good wide range of underwear now for breastfeeding. So I think that's something else too, you know, that needs to be looked into, that there's a wider range and they look nicer and you feel nicer as well, do you know? I know that sounds quite stupid, but it's a woman thing, do you know what I mean?
I'm Lisa and I'm a volunteer for the Northwest BAPS, and I facilitate the walking group up here. And we set it up about 9 months ago in response to a need locally. I moved back from living overseas for a long time and started attending the Derry group, but was living up here and saw a need and an opportunity. So, and the group is growing each week. We're seeing more mums locally coming along, and we do a walk locally around the bypass, and then we finish up with a cup of tea at a local cafe. And it's just a lovely opportunity for mums in similar situations to get together and to normalize breastfeeding, for them to share their experiences. And it's been a really great incentive to get going and to hopefully continue running with. Yeah.
Yeah, and just like yourself, my children are all grown up. In fact, mine's are a lot older. My eldest will be 34 this year. So it's just lovely. People like Lisa who have younger children as well, that are putting time into this to try and help other mums as well to become aware of what's available. But in the weekly walking group as well, it's a great opportunity for women to talk to each other and that peer support that's shared. And you were saying even locally, a mum came along with a newborn baby, a baby that was only a couple of weeks old. You know, the fact that people are getting out of the house, because I think that's a big aspect of it, is the isolation that a lot of people can feel in those early days and weeks. And it's so important to find your tribe and to know there's a lot of support out there. And part of our name, that we are the breastfeeding and perinatal support, that we signpost people to the whole range of services that are out there, including mental health support and things like that, you know, so it's really important.
So I think it's important to normalise breastfeeding. There's nothing more normal, do you know, when you think of it. But I think, like, I remember years ago, I worked in the doctor's surgery and a man came up to me. I was sitting at the front desk and he asked me to remove the mother breastfeeding because it was offending him. And I was going, why didn't you, well, I didn't say it then, but I felt like saying, why didn't you remove yourself? You know, this woman's just doing, you know, she's being a mommy and she's feeding her baby, you know. So I think that whole stigma and normalising it, you know, especially amongst men maybe, you know, because someone can be offended like when they do see it.
Some men actually can also be some of our greatest advocates, and at a lot of the events like the World Breastfeeding Week event, we're delighted when dads have come along and grandparents as well have come along to those events. And I think, you know, in terms of being supportive, that it's important that we also remember, you know, that men can have a big role to play in this. And also, you know, in terms of normalising and breastfeeding, for a lot of the mums coming along to the walk-in groups, that might be their first time breastfeeding in public. So it's great that they do that among other women, and then they can go out and breastfeed themselves, you know, whenever they're out and about themselves. It gives them a wee bit more confidence.
Yeah, absolutely. Just it builds up their confidence, and again, normalizing it. And I think when people are aware of the benefits of breastfeeding, there's likely to be more of an acceptance and an understanding of you know, how valuable it is as well. Yeah.
Thank you. The next indicated speaker is online, and that is Alderman Montgomery. Janice, go ahead.
Thank you, Chair, and I just wanted to thank Maria and Lisa for coming on and for the presentation. I actually never heard of you until last year, whenever it was highlighted about the mural down in Great James's Street. So I had been reading on these, and I see the fantastic work that you do. And I have mentioned to a few mums about yourselves to get in contact. As I breastfed my own three, and now they're 16, 13, and 10. But I wish your group was about when I was doing it, because it was there was a lot of like worried about what people thought about it, and having to do it in public. I was the only one in the family ever did it, and among my friends as well. So having that support and having yourselves would have been amazing, and I'm sure you're able to give that now to everybody that's at your groups. I was just looking to know. I know you talked about a walking group in Strabane, but do you just check with Mind and Mum here in the Waterside? I know they do walking groups. So I was just wondering, like, do you just team up with them?
Thank you so much for your comments. And yeah, we do actually link up with Mind and Mums, who are a fantastic group for all mums on the Waterside. And actually, Christine is a member of the Northwest BAPS network and had given us very positive feedback at the last network meeting, that she had been noticing that there seemed to be more mums breastfeeding locally. And they've also been very supportive in terms of coming to our events. And we recently distributed some of our breastfeeding support kits through Mind and Mums as well. I think it's a wonderful project, and that it should be everywhere, not just in the Waterside. And hopefully they will get funding again to continue.
That's lovely. Thank you, Maria. Any other indicated speakers? No. I'll say a wee bit, Maria. I also work, as you know, at the Bogside Brandywell Health Forum, and we had been invited along to one of your networking events, which was great, because a big pillar of the work that we do is nutrition. So we were thinking, we're talking about nutrition. We are talking to parents about lunch boxes. We need to have a wee breastfeeding element in there about, it's a good start in life. Obviously, we're not the experts, but we wanted to make sure that we were including the breastfeeding element of nutrition within our programs. And when I was on the meeting, there was a few representatives from the PHA. So our centre is now a breastfeeding welcome here centre, which I didn't know that you could do. You actually apply to the Public Health Agency, and they send you out a pack, and you can put stickers on your windows. You get a certificate for your wall. So I think promoting that too is a really good way of engaging our places that we all live in, so that it's like the community toileting scheme. Nobody really knows about that. There's a lot of businesses and organisations across the district who are community toilets, where they have changing facilities and baby changing facilities as well. So I think the promotion of that breastfeeding welcome here is a good one. And also around the nutrition, all the healthy living centres should be bringing the breastfeeding element of that in. So I wanted to ask, do you come and do talks about breastfeeding, the benefits nutritionally? I know you've mentioned all the benefits there at the very beginning, Maria, but is there any type of nutritional session that gives you sort of that in-depth information?
Thanks for that question. And I think in terms of the information around nutrition, it is something through the Breastfeeding Friendly initiative that's actually part of the modules. And I know the Sure Starts at the moment are going through that process. And the hospital staff have actually, the community lactation lead, Brona McSorley, would be actually assisting them in that process. So that's something that maybe in terms of reaching out to the trust specifically for the information on nutrition. But just when you're saying that, about the healthy living centres in general, Aisling, I think the opportunity for us to get involved in this international breastfeeding friendly cities project, where we have reached out to the University of Ulster, to a nutritionist in there. We've also reached out to the Public Health Agency, and both of them are interested in getting involved. And it would just help to take everything to a higher level, including, looking at, there's I think about 5 pillars, there's something like 52 indicators, and it would be testing the whole district, city and district area, as to where we are with all of these indicators. So for instance, information on nutrition, where we are and how far we've got to go would be part of that measurement. And it would give information back to the council And it may actually end up leading us to being awarded a breastfeeding friendly city and council award, which again would be a first for Northern Ireland. So, which would be exciting, but I think it feeds in very nicely to what you were talking about in terms of nutrition and making sure to get that information in at an even earlier stage than the preparation for school lunches and packed lunches and things like that. Yeah, good question.
That's lovely, Maria. Thank you very much. And we have noted about the paper being brought back about the ask, so we will keep on top of that, Karen, and hopefully we'll get a paper back soon. And Carol's very much involved with yourselves as well. But my daughter breastfed her twins until they were 6.5 months old. And when I breastfed my own children, but obviously didn't do it for that. I didn't do it for that long. And when I used to watch her, trying to be a mommy too, breastfeed and prioritize that, I took my hat off to her. I was like, it's hard enough doing it with one. But as Amanda said, see, when we went out then to buy the baby food, I nearly had the price of it compared to even when I had switched my children to formula feed. It was shocking, the price of it, because there's a specific one that if a baby comes off the breast, is it the optimal one as well too? And it was very, very, very expensive, but as I say, watching her doing that with wee twins, it just inspired me, even though I'm not going to have any more children. But I suppose our sisters watching her doing it, it's nearly normalised in our house now that you breastfeed. So, but ladies, thank you so much. There's no one else looking to ask any more questions or give any more comments, and we will keep in touch. And I'll let you finish off on a final note, Maria, but thanks very much again for coming in. The very best of luck with everything.
Thank you. Thank you so much for this opportunity this evening. And I hope that we can build on it and come back to you with a paper about our asks. And I would also like to say thank you already to the council in terms of Carol and the input, because Carol has been involved in these conversations about the international project.
Yeah.
And it's something that we want to hold on to. We know there's a resource implication to it and doing it properly. But already, Carol's input, and I know the fact that Carol's from Strabane as well, and the links in the council area between Derry and Strabane and everywhere in between, it's just so important. Which is why it was lovely last year when Lisa offered to get the group up and running. And we're actually now going to be part of the Lifelong Learning Festival in the beginning of March. Where the walking group is going to be a feature. And I think that just represents the fact that it is, intergenerational. And the more people see breastfeeding, the more younger kids see breastfeeding, the more normalized it is. And you're talking there about the twins, that we also are involved with the Twins Trust and other organizations like Tiny Life that are part of our network. And I also wanted to give tribute to one of the people who set up the first breastfeeding support group in Derry, which is Bernie Webster. And Bernie is actually part of our network as well. And I thought it was really important to reach out to those people that have been part of the history of this, that we're bringing it hopefully to another level through the council, through yourselves, but that there have been people that have been working in this area for years. And there's been amazing people within the trust as well. And we hope, that to make closer collaborations with them, the potential when people get together and organizations in terms of sharing resources and ideas. So we do look forward to turning these statistics on their head so that Derry and Strabane no longer the lowest breastfeeding rates in the world, but that we would be a model of good practice here. So thank you. And Lisa, would you like to say anything?
So thanks for having us. It's been a pleasure to come and have a chat with you and hopefully work together more closely in the future. Yeah. Thanks.
Brilliant. Thank you very much, ladies. Thank you. Members, just before we leave, I just wanted to bring up one more item. So March is Endometriosis Awareness Month, and we will be making a request for the buildings, both the council buildings and the Guildhall, to be lit up in yellow. Now, the request has come in from the support group that Carol is also working with, but it's just to let members know that the request has come in and we will be supporting it, and hopefully by full council we'll be able to announce that will be happening. Is that okay, everybody? All right. Thank yous and safe home.